And let me do one thing at a time. I'm going to adjust that acrylic to angle it off that canine.
Exactly.
And we'll try that back in.
Because that's really what's holding it up.
Yeah. We'll try that back in here.
And since we want to rotate the tooth, we want to get rid of pretty much all that acrylic that's on the distal portion. Just
lob it off.
Yeah, just slice it right off get that corner off. That looks good.
I probably want to get anything that engages the cingulum too, and that distal I want to get off of too, don't I?
Yes.
A different bird. So I told Tanya, I'll do it myself. No, why don't you get Francis?
And thanks for the vote of confidence.
I realized as much. So let's call France, get him over here one day, and just go through this, make sure that.
And that's exactly what you want to do right there.
Because as I mentioned before to you, I had an aversion to orthodontics since dental school. It's one of those things that just never appealed to me, probably the way they taught it. You know, I'd much rather do like perio surgery than orthodontics. And if this works out, you know, I saw the other patient here the other day, just yesterday, the one we did the same thing with the lowers.
Mm-hmm.
Looks real nice, just tweaking it a little bit. She has one that just needs to be rotated a little bit. So I sort of did the same thing. I added just a little bit of a cold cure acrylic on the part I want pushed in more.
Right.
So I told you just to try to rotate that out, and I relieved you had acrylic on the outside of that labial arch wire.
Yes.
So I relieved a little bit in that spot, so I figured I can push it that way. You know, just to get that to turn a little bit.
Really just simple mechanics,
yeah,
right?
Yeah. So, but otherwise, you know, that again moved quickly, and she's happy with it. So, if
now we should try that in and see
for clearances with me.
For the clearance, and then we're going to have to back off the labial bowl a little bit. Yeah, that's good.
Can you turn a little towards me? Do you want me to angle it even a little bit? It almost looks like to me that we're hitting almost in the center here. Maybe if I just come a little bit more, just to make sure we hit this part.
You know what? Looks good to me.
You think that's okay?
I think that's okay, because we're over the halfway point of the tooth, and where she's starting to where the rotation's starting is pretty much mid-tooth.
So push that out, and we're okay with that. So make sure we have clearance down on the bottom here.
Yeah.
So we're not hitting that
yeah,
cingulum here.
That's key, because you'll end up pushing the whole tooth anyway.
Maybe a little bit right here. I can feel something a little biting. Let me just trim that a little bit more there.
Right. We're certainly getting to the end on this appliance. It's good. Somebody's been compliant.
Yeah, she's been pretty diligent with everything.